mentioned briefly the physical activity guidelines in Australia. And if you think about someone who's dealing with anxiety or depression, likely they don't have the same extent of motivation as we do to, go and exercise on a regular basis. Now, if they're not meeting those recommendations, it's likely they're going to be disheartened to do nothing at all. So do you think in that respect, with the physical activity guidelines, there should be a push to incorporate some guideline that is, if you can't meet 150, 200 minutes per week of cardiovascular or physical or aerobic exercise, something is better than nothing, or something along those lines, to make people, because people can be very hard on themselves, especially with diet as well. You've seen no doubt a lot of eating disorders in youth, and if someone's not meeting those guidelines, they must feel like a failure to some extent, and that's really going to hurt their self-efficacy and their likelihood of engaging in physical activity.
I'm just vigorously nodding along everything you're saying. So yeah, of course, the shame is a factor.
Yeah.
So if people are not meeting these guidelines, shame can be an issue, and also the idea that the sense that unless we're achieving that 150 minutes, there's no point.
Yeah.
So Megan Teixeira is an associate professor at Deakin University. She's done some brilliant work on exactly this topic, and she wrote a paper. I think the exact title was "Do We Need Physical Activity Guidelines for Mental Health?" And that was published in Mental Health and Physical Activity. But articulating exactly what you've just said, and the idea that we need to consider that these guidelines are often built around epidemiological evidence for physical health issues. They don't consider the idea that if you are experiencing poor mental health and you manage to find some motivation to go and do a couple of minutes of movement to get out of bed to do something, that can be beneficial. So yeah, what you said around something can be better than nothing, I think is really important there.
Even like 10,000 steps a day, and the research that was coming out of, in order to reduce more mortality risk, I feel like that can cause more mental illness than it can prevent, in the fact is like analysis paralysis. You're like checking your monitor every day, and if you don't hit those numbers, you're depressed for the rest of the day, and then the next day you hit 15,000 and you're all merry. So yeah, I think there's something to be said there for those guidelines, and maybe making some amendments to facilitate people's expectations based on a lot of people's lifestyles. Don't if you're a truck driver, you've only got limited time throughout the day to be on your feet. So we've got to start to make some guidelines that work in accordance with, I guess, different people's lifestyles and occupations as well.
Yeah, I think that's really fair. I think that's totally fair. And I think WHO have done a good job, particularly in the recent updates, of incorporating mental health. And that was one of the first times that we saw mental health as a key theme. That's in the 2020 guidelines. But yeah, I think there's still a way to go around the real world implementation. But it's probably it's a balance. I understand from their point of view, they've got to look at the strongest evidence they possibly can, how that balances with the applicability to everyday people that are then hearing them. It's a balance, but I think there's more that we can do to ensure that those guidelines are informed by mental health and considerate of mental health.